I have many patients coming to the OPD to me after few months of their marriage, trying to get pregnant but not able to conceive. So they ask me, are we infertile? क्या हम infertile हैं? क्या हमें बच्चा कभी नहीं रुक सकता है? And I would say no. So what is infertility? If a couple is trying to conceive for at least 1 year and having regular intercourse without using any protection and not able to conceive is called as infertility. So hello everyone, this is Dr. Rasika P.C. Gulhane, IVF specialist, director Medigrace Hospital and Inaya IVF Nagpur. अब बच्चा क्यों नहीं हो रहा है, ये जानने के पहले हमें ये जानना बहुत जरूरी है कि नॉर्मली प्रेगनेंसी कैसे रुकती है. So every woman has a uterus, 2 ovaries and 2 fallopian tubes. So in a woman जिनका एक 28 to 30 days का साइकिल होता है, उनमें approximately 14 days पे, that is starting from the first day of your period to your 14th day. So in your 14th day of your periods, there is a follicle which is formed on your ovaries, जो around 14th day of your cycle rupture होता है and it travels into the fallopian tube and wait there to get fertilized by the sperm for around 24 hours. And during this time, if a husband and wife has an intercourse, then the sperms get deposited into the vagina. So ये जो sperms होते हैं, ये motile होते हैं. So sperms travel to the fallopian tube and out of millions of sperms, one sperm goes and fertilizes the ovum. And the fertilized ovum is called as an embryo, which then travels from the fallopian tubes to the uterus and there it gets implanted in a form of a baby. So this is exactly the way you get pregnant. And you can check this once you miss your period through a urine pregnancy test kit. And if you get pregnant, you get to see those 2 beautiful red lines in the urine pregnancy test kit. Sounds easy, right? But still 1 in 3 couples are still struggling to get pregnant. So what are the causes of infertility? Infertility क्यों होती है? So there are male factors and female factors. Yes, you heard it right. Males are responsible for almost 50% of the infertility. सिर्फ एक फीमेल ही नहीं, मेल्स भी इनफर्टाइल हो सकते हैं. So what are the male factors causing infertility? Testicular failure, abnormal sperms जैसे oligospermia, माने जिनमें sperms कम होते हैं, जैसे asthenospermia जिसमें motility कम होती है, azoospermia जैसे जिनमें sperms absent होते हैं and many more. Absent vas difference, genetic disorders, hormonal factors, ejaculatory factors, ejaculatory dysfunction and infections. And just like male factors, there are many female factors as well. जैसे tubal factors, tubes में कोई infection होना, कोई pus होना, कोई पानी होना, blood होना, tubes block होना. Then ovarian factors, PCOD जो आजकल बहुत commonly देखा जाता है. Then कोई ovary में कोई cyst होना, ovarian failure. Uterine factors like fibroid uterus, uterine polyps जिसे हम आम भाषा में uterus की गठान बोलते हैं, जैसे कोई congenital abnormalities of the uterus like biconjugate uterus, uterine septums and so on. There's another category where we are not exactly able to find out what is the cause of infertility, which we label as unexplained infertility, which is actually on a rise these days. So there are many other factors as well which are unclassified and they are common for both males and females. Like environmental factors, जैसे pollution, we are actually drinking, breathing and eating toxins, which is not only affecting the general health but also the reproductive health. Now next comes stress. Stress due to work, family and anxiety caused due to social media. Then comes the lifestyle. Like sedentary lifestyle, not exercising, putting on weight, which may result in infertility. Did you know by just losing 10% of your body weight may increase your fertility by 50%? Now another important factor is diet. Inclination towards junk food, fast food, then your timings, abrupt eating might lead to increase in weight and which in turn leads to PCO and infertility. So there's one peculiar factor because of which infertility is on a rise, that is late marriages in career-driven individuals. And late marriages that is indeed leads to planning the baby late, which results in decreased ovarian reserve, which causes infertility. So it is very important to be aware of infertility and take necessary help when needed. So this was a brief discussion about infertility, and we will be diving deeper into this subject. For any queries, you can DM us on Instagram. And you got some value out of this video, do follow us on social media. I am Dr. Rasika P.C. Gulhane, IVF specialist, Director, Medigrace Hospital and Inaya IVF Nagpur. And I'll see you in my next video.